Today we're speaking with Dr. Chris Boyer. Dr. Boyer is a hospitalist, an academic hospitalist at the University of Missouri in Columbia, and is chair of our hospital medicine committee. Good morning.
Morning.
So can you tell us a little bit about your current practice and position, what you do on a day-to-day basis?
Yeah, so I'm more of an academic hospitalist, so not your traditional kind of what a lot of folks will refer to as a kind of a private hospitalist, but still very similar. But I work at like you said, the University of Missouri, so I work in a training institution with a lot of internal medicine residents, along with a lot of subspecialty fellows. And then my particular type of practice here is all hospitalist-based work, and we have a variety of different medicine teams, some with internal medicine residents and some without.
So when you practice, is it all on general medicine inpatient services, or do you sometimes cover specialty services?
So I particularly cover just a lot of the general internal medicine services. We do have some, hospitalist service lines that are, I don't know what the best word for it, kind of contracted with some subspecialists. So we do have a hemonc service that is run by one of our hospitalists. We have a cardiology service that's run by one of our hospitalists. And those tend to be hospitalists specifically hired for those positions, and a lot of them are looking for that concurrent fellowship. So they do their 1 or 2 years and usually apply and end up going into that subspecialty.
How did you end up being an academic hospitalist? What led you to it?
For me, I had kind of a unique path, I would say. I did the military right out of med school. So I did my internal medicine residency training in a military institution. Following my training, which I have no regrets about, my training was excellent, and I would say it was on par, if not above, the training institutions I see here, kind of in the non-federal, non-military training. However, the 4 years that I had to owe them after my training was a little bit different than any other type of practice you probably would see out in the private world. And so I unfortunately, my training as an internist is directed towards adults and some of the geriatric population. Well, in the military, I saw a lot of young kids and a lot of young folks, not really complex stuff at a lot of times. Although I did have some interactions with a lot of the VAs, which definitely have, your older, more complex, internal medicine appropriate style patients. But for me, coming out of that type of practice, I was looking for a place to practice hospital-based medicine, but also have a lot of subspecialty support until I could kind of get back comfortable in my field of complicated internal medicine pathologies and things. So I wanted to feel comfortable, as an internist hospitalist before I potentially jumped into a, kind of solo private hospitalist, non-academic training area.
Are you considering leaving the university and going into private practice now that you've been doing it for a while?
Yes, actually, I have recently signed a contract. So I will actually be leaving the university here at the end of my contract in June, and have signed with a hospital in southern St. Louis County, Mercy South. Used to go by the old St. Anthony's, I believe. And it's traditional hospitalist type work, non-academic, non-teaching institution.
What do you think the pluses and minuses are of the two different practice styles? What attracts you to that as opposed to remaining where you are?
I think there's a lot of different things. For me, specifically, so St. Louis is home for me. So going back to St. Louis is where all my family's at. It's home. I have three very young children. My oldest child is just getting ready to go into kindergarten, and so and my wife stays home with them all the time. So for me, it was a big family decision. What's the best for my family? So my wife has more support with family support in St. Louis. My job, I should say, is more predictable, if that makes sense, and I can elaborate on that. And as well as getting my child into a school that I think we want to potentially keep him in all the way and not having to uproot him from school to school to school. So there's a lot of, outside the job, more family focused that drove kind of this decision. Now, as far as what I said about the job being a little more predictable and things of that nature is, my work and job here at the university was actually surprising to me, because I came to a university and academic teaching institution thinking, well, this might actually be easier. I have residents, they're going to see patients, they're going to write notes, less of that, kind of busy work, computer work. But I personally found it not to be that, that it actually is probably a lot more work at an institution like this. And I took it upon myself that, if you're going to be good at what you do and you're going to be a good academic hospitalist, then you have to invest a lot of time in these trainees and the trainees come and go and they rotate. And so of all different varieties and skill levels and classes. And so there's some that are great, they're phenomenal, and they make your life really easy. And there are some that they need a lot of attention, a lot of work, and a lot of help, and and that's on you to do, while caring for the patients. And so it's, for me, private hospitalists, because I've moonlighted before, and when I would see patients on my own, it's very nice to know I know what I told them, I know what I wrote in my note, I know what I actually did. When I'm having to relay it to somebody, I was always told, you trust but verify. So I can say one thing and talk to somebody, but then there's that kind of extra burden, extra workload where you're going back in, making sure it was done, writing the note, like making sure the note reflects exactly what we're doing, making sure the care is actually being delivered the way you want, and then the added layer of actually making sure the trainee got what they were supposed to get out of that encounter and what training they were supposed to get. And so for me, this academic facility was great for me to learn, to get back on my feet and do exactly what I want, but I was a little surprised at the amount of workload it takes at an academic training institution. And and that being said, that's kind of where the unpredictability, I think, comes in, because when you're doing it on your own, you know what's done, and you can manage your day, and you can kind of predict things, and when you're trying to get out at 4 or 5 or 6 or whatever it may be, you can plan your day and make that happen. When I'm working with residents, I'm following up and doing stuff, and I may find out at 4 o'clock something wasn't done right, and now I have to run back and talk to a resident, call somebody, and I'm stuck here for another couple hours trying to make sure care can be delivered or something can be done. So there's a little bit of unpredictability there, trying to make sure things are done. So.
All right, well, when you go into practice, please tell all your private practice colleagues that academic doctors work harder than they think they do.
Yeah, no doubt about that. Yeah, no doubt about that.
So did you ever think about taking a subspecialty fellowship? Was that something you were ever interested in? Do you have any, lingering thoughts about that or regrets?
So to answer the first part of that question, yes, I did. I did think about doing a subspecialty, which also was one of the other reasons a driving force to come to an academic institution, is because I originally thought I wanted to do a cardiology fellowship. I really liked cardiology, did both my, kind of resident grand rounds on cardiology topics. It's what I found most engaging, in the field I wanted the most. But I got here to the institution. I liked what I did. I liked training with people. And then I personally, I saw what the cardiology fellows did, and I saw what the cardiology attendings did, and I saw their lifestyle and their call schedules and things of that nature. And and I think my perspective also changed over time as well, if I was honest with myself. I made those decisions of what I liked and pursuing fellowships and things probably when my kids were, well, my first child had just been born, was very young. And so coming back to it when I was here talking about it, now I have 3 children, getting older, looking at school, and the family life and the family impacts weighed a lot more on that decision than they did previously when I thought about pursuing the fellowship originally. So for me, probably the biggest impact to that change was the family dynamics, how much time away I would probably be from my family had I pursued a fellowship. And then, my passion, I think, for medicine continued to kind of actually grow as a hospitalist. And, I'm the type of guy that I need things to keep me stimulated. Complacency is probably my enemy. And I feel with some subspecialties, you start to get down a path where you kind of potentially start doing a lot of the same thing over and over and over again very frequently. I feel in the world of hospitalist medicine, any given day I have between 15 and 20 patients, and it's every end of the spectrum. So I am something very easy to something very complex critical care, and I get to dabble in all aspects of medicine. Still to this day, I'm constantly learning things every day, things I know I've learned but have to remember and have to relearn, and so it's challenging me to an aspect that I don't think I will ever learn everything I need to know in internal medicine, and will constantly have to continue to look at books, and that's about where I want to be for a career, something that will continually keep me stimulated, continually keep me working, continually keep me learning, while also allowing me to still have an adequate amount of time with my family and do the things I want to do outside of my job.
So that provides a convenient segue into the next general set of topics, which is work-life balance. Can you say something about how you feel about the adequacy of your current work-life balance?
Yeah, so I think everybody might have to say something a little bit different about this, but I think from at least my perspective, hospitalists have a really good quality of life. The kind of standard typical schedules of week on, week off, so many weeks a year allow for a really good balance. There's a lot of time off, a lot of time with your family, allows you to do things. And then depending on the facilities and structures, a little more specific to where you may be, that can only get a little bit better, a little bit worse. And in my perspective, looking at some subspecialties, they chew in a little bit more to that free time you may have with your families at home. And so, for me, I like to be home. I like to go to family events. I like to go to holidays. I like to be around my kids. I like to coach my kids things. And for me, being a hospitalist, I can still do all of those things. Last year I was able to still coach my kid's t-ball team, and go to his games and things like that. And it didn't interfere with my job or work or timing, didn't feel stressed. And that's the things I like to do. Had I had to work an extra week of the month in clinic on top of my 2 hospitalist type of things, like a lot of subspecialists have to do, that would have been very difficult. It would have been much less time at home and things of that nature. So,
Have you ever felt burnt out, or like you were in danger of becoming burnt out?
Only maybe recently in this last year, well, during the COVID pandemic, because we had an isolated COVID unit, and I was kind of a guy that was put up there fairly first, and stayed up there almost all of last year. And I would say probably did 75% of my clinical weeks on that particular service. And it kind of wraps back to what I mentioned earlier. And to my own fault, I volunteered to do that. I said, yeah, COVID's exciting to me. It's a new age of medicine. We don't know anything about it. I would love to be there at the front lines and try to figure out what's happening. The same way I originally thought, I love cardiology. I want to do that. I want to go seek that. That's what I love to do. It only took 6 months to start seeing the same thing over and over and over, and only knowing, I'm doing the best I can do, and I'm waiting for other clinical trials to come out and other bench work to get done and other things to get done to actually let me know if I'm doing a good job or if I need to change practice or whatever. And so that, I started getting a little burnt out, a little tired, kind of a desire to start seeing something else. And so, I think for me, that feeling of starting to feel a little burned out started to kind of validate why I didn't want to do a fellowship and why, medicine and a hospitalist was the gig for me. And then, it was even more validated whenever we started getting on the backside of this pandemic and we started de-escalating the COVID service line. And then I got to go back to a teaching service and started to see, the infectious endocarditis and the cellulitis and the pneumonias and, the abscesses and all these other random medicine things. And I felt very stimulated again then. It all felt very new to me again because in 6 months I'd seen a lot of this stuff. So it was reinvigorating for me to even just do the things I did a year ago. So for me, it just continued to validate that this is what I want to do. So
yeah, I editorialize a little bit with my own opinion. I think oftentimes residents are drawn to a career by what's glamorous in the field, and when what they should really be looking at is what people in that field do every day, day in and day out. And I think had I chosen, especially immediately out of my research training, I probably would have done rheumatology, but because I did something else for a period of years, my thoughts about what I wanted to do and how I wanted to spend my time changed totally. So I think that people are excited about what seems glamorous and challenging about a field, but don't really spend enough time figuring out what that person does every day, day in and day out. So do you feel fairly compensated? Do you think you're getting paid enough?
I mean, I do. I feel completely comfortable with what I make, and do I think academic physicians maybe should make a little more? Yeah, no doubt. Like we just mentioned, this is a tough job compared to what I think, colleagues might do in non-academic settings. So I think, maybe the compensation should shift a little bit, but am I distraught or distressed or disgruntled by any means in regards to what I make? No, not in the least. I'm very comfortable with what I make, and that's my wife's at home. I have 3 children. We live off of one income, my income, and it's more than enough.
Able to take the vacations that you want to take and so on?
Oh yes, very much so. And could I go do other things, and could I work a lot more and make a lot more money? Yes, but we are absolutely happy with what we got, and we still are able to do all the things we want to do. And gone on a vacation every year for the last several years, and yeah. I mean, as I grow older, perspectives, I think for me and my wife and things change. And to reiterate what you said, things that were once glamorous right out of residency and things are not glamorous now. Perspectives have changed, you know, being able to spend that time with family and in your extended family, and having that time off and, you know, enjoying going to work every day, is what I look for, you know, and I feel like I've found that. I don't regret going to work any day. I enjoy coming to work every day and look forward to what kind of work is going to be in front of me.
Well, will there be a significant change in your compensation, leaving Mizzou and going to Tony's?
Yes, yeah, there will be a significant, you know, an increase in pay. To, you know, I've not had too many jobs, so I can't really compare, but, you know, I consider it a pretty significant increase.
So what do you think, what are some things you wish you'd known before you took your first job? You know, yeah, and looking back.
Yeah. You know, so the military, I think, maybe helped me train for this appropriately and at least understand the importance of it. And having worked, you know, in a couple different facilities, and nothing against the facility I currently work at right now, I've moonlighted a lot of places as well. And a thing I wish I would have known is, you know, what is the work environment? How is the team? How is the culture in the department? You know, and what are the opportunities, you know, aside from that, what are the opportunities for growth, you know, professionally and personally and as a facility? So, I mean, those are a little bit two different things, but, you know, the military puts a lot of focus on leadership and teamwork and things like that. And so I kind of knew coming to the University of Mizzou that I was looking for a good team. I wanted to be part of a good team. And I think I found that here. I think Mizzou's got a good team, no doubt. However, I've been in some other facilities where, you know, the work is somewhat the same, but it is a very disgruntled team. And, you know, the patients coming to the door are the same amount of sick, if you will, same amount of care, if you will, or whatever, but that collegiality and that teamwork and the willingness to help each other out and things can really have an impact on your feeling of coming to work every day. If you feel like you don't have the support from a team, and people aren't there to help you, and your leaders aren't necessarily to help you grow from a personal and professional standpoint and things like that, then it's hard to engage in your job for the long term. You can come in and feel excited about your job, but over time, I think you'll begin to feel that pressure, that stress, that lack of support, and it bears on you and it weighs on you, and then those things can tend to disrupt, you know, you enjoying your work every day. So to me, those things are very important. Having a work environment and a team that are, you know, very united, very collegial, and having leaders that are also looking for, you know, optimizing that and then growing their folks personally and professionally. And those are the things that you know, allow me to enjoy my work every day.
So let me ask you this: if you're a rookie, you know, you're coming fresh out of residency, and you're looking at your first job, and you don't have a lot of experience, how can you figure out what the environment's like in a new place? What should they be looking at?
Yeah, so that's the tough question. You know, and I asked. All I can tell you is really what I did is I asked pretty point blank in a lot of my interviews, so much so that I even kind of reached out to some folks that maybe I didn't get interviewed that were just other hospitalists, and kind of off script or off the beaten path, and tried to get my own insight to, how do you feel about the place? Is there a good team? I asked pretty point blank, how's your team here? Do you like it? Do you all like working here? Sometimes I think there's, I've interviewed a lot of people here at the university applying, and not a lot of people ask questions like that. They kind of ask, what's the schedule like, and what do you see, and what's the pay, and is the pay negotiable, and things like that. What's the benefits package and stuff. But rarely do I ever get asked, do you like where you work, by an applicant. And I think that's kind of an important question, and getting an honest answer is also important. And if you don't get an honest answer from, as the applicant, if you don't get an honest answer from who you asked, then that's already kind of a red flag, I think. So somebody should pretty openly be able to tell you that, yes, I enjoy where I work, and they should be able to do that with a little bit of enthusiasm. And to me, that's at least an inkling that portrays that they must have a pretty good work environment there, a pretty good team.
Thank you. So what do you think is going to happen to, or do you think anything's going to happen in internal medicine over the next decade or so that will impact on, medicine in general, your practice in particular, life in Missouri and so on? Have you sort of looked into your crystal ball and tried to figure out what's coming down the line?
I haven't. Every now and then I think about this very philosophically. I never put a lot of focus into it, but I think probably internal medicine is likely to at least first split paths a little bit and divide into probably a hospitalist path and probably a primary care like clinic path or outpatient type path. Because I think there's much less, even though the training right now of internal medicine is both of those combined, I think following that training, the jobs that exist that actually incorporate outpatient and inpatient are starting to be few and far in between. Most people who come out of internal medicine training, at least in my experience and stuff now, are going into either a hospitalist job or an outpatient clinic, and not a lot of both. And so I think, at least my perspective is that they're probably at some point might discuss changing that training a little bit to cater to the path that one is seeking out, which I think could have some significant benefits. However, personally thinking, could also have some downfalls, because as I just said kind of earlier in this interview on several talks, as I get older and my career advance, my perspectives have obviously changed already, and I'm still very young in my career. So what I thought I wanted to do, it didn't take long to change, and I hope to consider myself not naive enough to think that it would, it is very likely to change again. And, I could get 10 years down the road and say, you know what, I'm tired. I don't want to come in and around. I want to be off on Thanksgiving. And I may want to say, I like the clinic life. I want to go Monday through Friday in clinic. And so I would hate to be stuck on a path that way and get trained that way and then decide later I like clinic. So I think there's pros and cons to what I think they may do with the training program and what internal medicine may become.
It's interesting, again, to editorialize a little bit, I was an examiner for the American Board of Emergency Medicine for some years. And, you know, early in their career, people were attracted to the blood and guts, shift work, days, nights, and so on. But as I got to know these people over time and watched their careers progress, the day and night shift work became less and less attractive as they had kids who had basically a Monday to Friday weekends off life. Number one. The other thing I would say, based on my own experience, was that I nearly took straight critical care training, but I thought that that at that point emergency medicine was starting to show some evidence of burnout among practitioners, and I thought the same thing might well happen in critical care. So I decided to do pulmonary and critical care, and it turned out to be a good decision, but not for that reason. And the reason it turned out to be a good decision was that when I was young, old people weren't very interesting. And when I got old people became very interesting. and
Yeah.
As we began to share more life experiences, and I began to enjoy the outpatient practice of chest medicine much more than I had before. So I think you're right in a way that it's not unreasonable to prepare yourself in advance for career shifts. So, any other thoughts? Any other thoughts you'd like to share with the next generation?
Nothing too specific, just vague. Keep your mind open, keep the doors open, be willing to go to work every day. Be willing to jump into something you're afraid of, because it'll be more exciting and you'll learn the most things you ever will learn out of those things. And that's really about it. To reiterate what you said, be very wary of what appeals to be glamorous, because not all things, painted in gold are that glamorous. So,
I appreciate you taking the time to talk to us.